According to Tilburg, Hampton, Pearson, and Wishmega, diabetes affects 150 million individuals worldwide. It is estimated by the year of 2025, 300 million people will be affected by diabetes. According to the Center of Disease Control and Prevention, 90 to 95% of these individuals have type 2 diabetes mellitus. Hello everyone, my name is Kelly Madrid. I am a full-time nurse and I am a full-time student at Los Angeles Pacific University. As I was a child, I grew up with a grandpa who had type 2 diabetes mellitus. And as I grew up, I have a father who was diagnosed with type 2 diabetes mellitus. When I was growing up, I saw the effect that had on my grandpa's health. Acquiring diabetes mellitus type 2, he did not take care of it at a young age and had further complications. I'm a nurse and I work with individuals who have diabetes mellitus type 2 as well. As I go through the medical history, they suffer from hypertension, kidney diseases, and vascular diseases. In this speech, I will be discussing what type 2 diabetes mellitus is, who is at risk of getting this disease, what are the signs and symptoms of it, what are the complications when someone doesn't manage this disease, and the management of this disease. With diabetes mellitus affecting about millions of individuals in this world, my thing for you guys is to understand how you can control the diabetes by diet, physical activity, and medication. So we're going to start off with what diabetes mellitus type 2 is. So diabetes mellitus type 2 is the lack of insulin or the lack of where your body stops responding to insulin. Okay, so what is insulin? The pancreas produces a hormone called insulin. Insulin uses the blood sugar to travel to the body cell, and have the cell use that sugar to use as energy. With type 2 diabetes mellitus, the sugar level, the blood sugar, stops responding to insulin. So that increases in the blood, causing a high sugar level reading. So, who's at risk of getting this disease? Family history. What does that mean? If you're an individual that has a parent, a grandparent, or a sister or brother that has the disease, it's most likely that you're going to have that disease as well as you get older. Okay? Obesity patients or individuals. So, patients who are overweight. The lack of individuals who don't work out. So if you don't have physical activity, you are at risk of getting the disease as well. And it also depends about race. So you have African Americans, Hispanic, Latino Americans, you have American Indians, or Alaska Native. So if you have one of those races, you are acquired getting this disease. So what are signs and symptoms? Signs and symptoms. There's 3 P's. It's polyuria, polyphagia, and polydipsia. Polyuria is frequent urination. Polydipsia is frequent thirst, so active thirsting, continual thirsting, okay? And then polyphagia, an increase of appetite. Other symptoms an individual experience is tingling and numbing of the extremities, so it's the hands and feet. It's fatigue, increase of tiredness, and blurred vision. So complications. What happens if you don't take care of this disease or manage this disease? One complication you can get, hypertension. What is hypertension? Hypertension is high blood pressure, so increases the workload of the heart. Another disease you can acquire from diabetes mellitus type 2 if it's not taken care of is nephropathy. What is nephropathy? Nephropathy is damaged kidney or kidneys. According to Giancarlo Robardi, nephropathy is present in 20% to 30% of individuals with type 2 diabetes mellitus and is the leading cause of end-stage renal failure. What happens if you get end-stage renal failure? You have to get dialysis. Dialysis can last up to 10 to 20 years, and unfortunately you have to get a kidney transplant. Another complication is neuropathy. What is neuropathy? It's damaged nerves that affects the hands and the feet. So what happens when your hands and feet are affected with the nerves? The nerves make you feel. If you don't have sensation, you're at risk of developing an ulcer that can get infected and cause amputation to the foot or the hand if it's not taken care of. With diabetes mellitus, you are at risk of recovering longer, as in it affects your recovery status, your immune system. It takes, instead of taking a day to heal, it'll probably take 10 times worse. Another complication of diabetes mellitus type 2 is retinopathy. Retinopathy is where the retina is damaged. The retina is a layer of tissue in the eye that helps an individual see. If that nerve or that tissue is damaged, you're at risk for blindness. Okay, so how do you manage it? Well, there's a lot of ways you can manage it. You do need a medical team, so as in the doctor and patient. You have to get a hemoglobin A1C. Hemoglobin A1C is a sugar testing, so it tests the percentage of the sugar within the last 2 to 3 months. That testing at least needs to be done twice a year, or whatever your physician protocol is. Another management is by doing blood sugar strip testing. So you get the machine, put a strip in there, and then you have to poke yourself at least 3 times a day and before you eat to check where your sugar levels are at. Your sugar level for a diabetic patient type 2 should be between 80 to 50 milligrams per deciliter. After eating, it's a little higher, it's expected to be higher, but this is where you manage it. You have to check it 3 times a day to see how effective your eating habits are, how effective the medication is doing for you. Okay? Another is medications. One common medication that we see for diabetes mellitus type 2 is metformin. Metformin is used to suppress the glucose levels, so decrease the glucose levels. Okay? Another medication they use is SU, which is sulfonylurea. That medication is insulin. Insulin is a hormone, so with that medication, it helps the stimulation of insulin secretion. Another way is diet. Diet's the number one main important management, because as I stated before, for risk factors, obesity is one of the risk factors, right? So diet, you have to maintain a diet. Avoid processed red meats. You have to avoid refined grains and sugars. So anything processed has to be avoided. You can eat whole grains such as brown rice. Brown rice is perfect. Quinoa is okay, and oats. And then you can do fiber as well. Fiber such as vegetables, broccoli, Brussels sprouts. You can do nuts, and you can do fruits as well. All natural sugars, but you also have to limit on the natural sugars, just because the whole thing with diabetes mellitus type 2, it's an increase of sugar levels. That's what it is, okay? You do have to avoid sweets, beverages that are sweetened, avoid Coke, and then an increase in water. You need to drink a lot of water to get that blood flow going. And then the last management of it, physical activity. Physical activity can be every day, at least 30 minutes out of the day, or it can be 3 to 5 times out of the week you can work out. Okay? Make sure though when you're doing physical activity, you do have a snack with you, because your sugar levels can come down and you have to eat something to bring it back up. Okay? In conclusion, diabetes mellitus type 2 affects millions of individuals, but it can be manageable. You manage it by diet, a good healthcare team, and physical activity. And by managing, you avoid those complications that were stated before. You avoid the risk of getting hypertension, avoid the risk of getting end-stage renal failure, or the avoid of getting blindness. So if you're diagnosed with diabetes mellitus type 2, it's not the end of the world. It can be managed and it can be controlled. Thank you, everyone.
All right.